It is our great pleasure to introduce our speaker. Gate is really delighted to be partnering with Dr. Asa Radix. Dr. Radix is Executive VP for Research and Education, Kellen Lord Community Health Center in New York, and Clinical Professor of Medicine at NYU Grossman School of Medicine. They have over 2 decades of experience in providing care to trans and gender diverse individuals and have contributed to national and international guidelines on trans healthcare, including as co-chair of the WPATH Standards of Care. Their research predominantly focuses on HIV prevention and healthcare access and outcomes for trans and gender diverse persons. Over to you, Asa.
Thank you so much for the introduction. And yes, I'm just really excited to be here to, talk about creating really effective abstracts. And, as I reflect back, I remember the first abstract that I had accepted at a, major international conference, and it was when I was working for a CBO in the Caribbean. And, it really led to so much for our organization in terms of networking and so forth. So I am going to spend the next probably 40 minutes going through how to create effective abstracts that hopefully will be accepted. This is the roadmap of today's webinar. We're going to talk about why abstracts matter, for CBOs, which are traditionally not doing research, but doing a lot of programs, thinking about what are the benefits to your organizations. We will be covering, AIDS 2026 and WPATH 2026 is just two examples of conferences that you can submit your research to. We'll talk about the structure of abstracts, how you can turn the work that you're currently doing, again, into measurable evidence, what reviewers are looking for, which I think is really important, and then we'll go through some tips and common mistakes. I will have a few abstracts for you to quickly look at, and of course, there will be time for a Q&A. So the first thing I wanted to start with is just discussing what is an abstract. And actually, there's one other thing I wanted you to do, if you're able. If you can uh, just think about questions as I'm going through that you want to ask, because, we are reserving the Q&A for the end, but just jot down questions as I go through this. So again, what is an abstract? So, an abstract, is your one chance to highlight what you're doing as an organization as far as a specific project. It's a standalone statement that briefly explains the essential information of a study, a research project, a policy, or a program. And the idea is, of course, that it's giving people an understanding of key questions, problems, methods, findings, and why is this work important. Traditionally, an abstract for a conference is broken down into 4 sections. Sometimes they may have a fifth section, sometimes they may call the section something a little bit different, like background. They might say introduction, but the background, why is this issue important? Why does it matter? Methods, what you did, the results, what happened, and then the conclusion. So there you're going to write about, key takeaways, why it matters to others, what are the present or future impacts of your program. So, I wanted to also, as we're going through, start with this paper. That this is an incident that happened in 2019, and it really highlights why it's so important that CBOs present their research at conferences. In 2019, at an IAS conference, there was a session that was called Perspectives of Transgender Women on HIV Prevention and Care. And many of us went to that session. And what we found was that it was a panel, 100% cisgender researchers talking about the needs of transgender women. Nowhere were there community people talking about this issue. And in fact, at this IAS meeting, there were very few abstracts. There were just around 50 or so, and only around 30 of them even disaggregated trans people from cis people. So they combined transgender women with cisgender men, or MSM. And the authors highlighted the importance of community-led research that is being presented by members of the community, being presented by trans people. So this is what we're trying to do. And hopefully this webinar will uh, hopefully double the number of abstracts that are submitted and accepted at these major conferences. So, I wanted also to highlight that as community-based organizations, you hold knowledge on community issues that academic and government systems often don't capture. You have lived experience, you see trends, and you understand community priorities. And really, abstracts will provide a pathway for that expertise to shape national and global conversations. So don't underestimate your worth. Your voice is as important and probably more important than many of the academics who are presenting at these meetings. I want you to think about the benefits for your organization of submitting abstracts to conferences, okay? And there are many, it's going to build visibility for your organization and credibility in the world. It's a way for you to document community needs. It validates community leadership and expertise. It definitely strengthens advocacy and policy influence. And many of you have funders, so seeing that you're able to, perform on a global stage and present your work obviously is going to increase confidence in your organization. Partnerships and collaboration should never be underestimated. The networking at these conferences is immense. Obviously, building capacity for monitoring, evaluation, and research, and, essentially is going to shift research agendas towards real community priorities. So, definitely that professional development for your staff, is important. And again, you'll see the IAS AIDS conference has scholarships, right? If you have an abstract accepted, your chances of getting a scholarship go up immensely. So let's go to the next part. How do we move from a project that your organization is currently doing, to an abstract idea? And, this is one project that we're going to talk about a little bit later on, because it did actually lead to a fruitful acceptance at a conference. So this is a trans-led CBO, collaborates with another organization to train clinicians in trans care. So here's the abstract idea. Community design trainings improve clinician knowledge and access to gender-affirming hormone therapy and HIV prevention services. And why does this idea work? It's, you're doing the work, but here we have an idea for an abstract. There's a clear message, there's an impact, and there's a broader lesson. So, and this is what we're going to do with all the projects that we discuss. So the first thing is you want to start off with a core question. So what did we learn from our project? Some examples could be, you might be conducting monthly peer-led gender-affirming care navigation meetings. So maybe there's an abstract there that you could think about how, peer support improves engagement in gender-affirming hormone therapy services for trans adults. Maybe you have a project that is doing outreach to sex workers on HIV testing. Again, there's an abstract idea here. Perhaps you could be talking about how community-led outreach increases HIV testing uptake among trans sex workers. So really almost anything that your organizations currently do, you could think about how to present that work as an abstract that can be presented in an international forum and, present lessons to other organizations that are thinking about doing similar work. You have to think about the why, right? So why does this work matter for the community or field? If it's not important, and if you can't explain to the reviewers why it's important, you're not going to be able to get this abstract accepted. So why does this work matter? Some examples would be, you know, that there are a few models that exist for trans-led hormone navigation. If you're the only one who's doing it, you need to explain that, you know, this is important because it's not being done. Trans sex workers face major barriers to clinic-based HIV testing. That is true. You need to make that very clear in the abstract. How about legal ID changes remain a structural barrier globally, right? That's true, but you have to, in the abstract, right at the beginning, so this would be part of the background, explain why your work is important. So again, this is going to be part of the very first part of the abstract, the background or the introduction. You need to think about turning your project activity into a result that, again, you can discuss. So, you know, you might be thinking, okay, we held some workshops as part of, our programming. So, again, how are you going to turn it into results? So workshops improved confidence to navigate clinics, right? We trained staff. Yes, you did train staff, but how about thinking about the results? Staff knowledge on trans health increased by 40%. These are just some hypothetical, results I'm putting in. How about, maybe in your programming, you provided antiretroviral support and education, right? But perhaps this antiretroviral support and education increased uptake of antiretroviral therapy and improved viral suppression. So again, you want to see the, whatever your project did, what was the end result? Again, this makes it important. Like we need to we want to know how to replicate this in other areas of the world, and uh, you know, having the abstract acceptance will allow you to disseminate your findings. Again, you want to identify important outcomes. So, what are the most important or impactful things that you found in your project? So, some examples would be, participants reported increased safety, or PrEP uptake doubled, or legal ID support reduced barriers to employment, right? So, it's not just about describing your program. You want to see some results. And I will say when, you talk about outcomes and results that, many community-based organizations get very worried that, maybe they don't have the expertise in-house to conduct, complicated and, statistical analyses. But the fact is that you don't need complicated statistics, right? You can use descriptive statistics, which would be, describing, you know, outreach and how many people you reached, the number of providers who were trained in the example of conducting, uh, clinician training. You could do some qualitative, so analyses, so themes from stories that you've heard from your clients. You can do before and after comparisons, lessons learned. Here's an example. We supported 73 trans people with legal ID changes, and 89% completed the full process. So it doesn't need to be anything exotic. You can do descriptive statistics. You can do some qualitative analyses, inferential statistics where, you have a sample and you are basically making predictions about a larger population. Yes, that will require more advanced statistical knowledge, but it's not required for probably a lot of the descriptions of the programs that you're going to be doing. The other thing is you want to think about lessons learned. Okay, so what can other CBOs learn from this project? And here are a few examples. So, peer navigators can reduce fear of discrimination, or telehealth is effective for rural trans communities. Funding small trans-led groups leads to measurable HIV outcomes, and this is going to be your take-home message. As you'll see, some of the abstracts allow a section on lessons learned. So, like, these are the things you want to highlight, the successes of your program. The other thing is choosing the title, and you'll notice that I put the title at the end and not at the beginning. Sometimes you don't know what the title is going to show until you've written the rest of the abstract, right? Because the title is going to capture the key messages, right, of your program, of your abstract. It can include the populations that you served. It can include some of the key findings or outcomes. If people remember only one thing from this abstract, what should it be? And you can make that the title. I think that's a very easy way to approach this. You can look at the conference theme or tracks and, echo some of the language that they use to increase relevance to the particular conference because, sometimes conference reviewers are asked to check a box. Is this aligned with, the conference and, what we're looking for? So definitely try and squeeze that in. You want to be specific and avoid vague or general titles. So weak would be, improving access to HIV services. A better title would be, peer navigation, increased HIV testing uptake among transgender women in Nairobi, right? That tells you exactly what it is. It's not vague. It talks about the population, talks about the geographic area, and actually gives you the results, right? Increase HIV testing uptake. I want to read that abstract. I want to accept that abstract. So it's also time to be creative. Sometimes people put, really kind of fun titles. And absolutely do that. You want to remain professional, but you have a lot of opportunity to play around with your team and come up with something creative. So I wanted to give you some concrete examples here. So this was one example, which was improving clinical services to trans people in the Caribbean. So TransWave Jamaica, it's a trans group, worked with ECADE, or the Eastern Caribbean Alliance for Diversity and Equality, based in St. Lucia. They got funding to provide cultural competency trainings to healthcare workers in the Caribbean. It was mainly focused on prescribers, people who could potentially prescribe hormone therapy. But, there were other healthcare workers there too, like nursing. But the question is, that we were asked is, could this be developed into a conference abstract? They'd done the work, they're all, trained, a great number of clinicians. Had some information on, at the end of the training, people filled out questionnaires on what they thought of the training, and they also had pre and post surveys to see if there were, any changes in knowledge of clinicians. So, this is the actual abstract, right? So the background, remember I said that it's like why this issue matters, right? So in the background, what they pointed out was that the Caribbean ranks as the second most affected region globally in terms of HIV prevalence. So very clear that this is important. Also, that there are disparities that exist among trans individuals, with HIV prevalence exceeding 25% among trans women. That is important. The other point they made was that trans people in the region face many obstacles to accessing, HIV services. And some of that is because that there's a shortage of informed healthcare providers. And there's limited availability of gender-affirming care. So they already laid out the background that this is an important issue, right? This is why we did the project. So they've checked all the boxes, why this issue matters. And then the description, the methods, what did we do? So what they did was they did a pilot training, and the goal was to improve knowledge and skills and attitudes of providers. And it explains a little bit of what they did. It was a 2-day training in Jamaica. They had, 28 participants. And, they had 10 modules, and they did some activities. It also shows that they did some pre and post training surveys, and that actually there was an increase in provider knowledge. And then they went on to lessons learned, right? So what were the lessons? What they found was that, they were seeing providers from many different countries and that the training had to be tailored to accommodate the experiences of the participants and the different communities. They also, when they looked at the forms at the end of the training, they found that the providers really were engaged by interactive training, such as the real case scenarios, the interactive exercises, the tabletop activities, the role plays, case-based vignettes. They also had panels with, you know, uh, trans clients. And having the involvement of trans community members was really important. And what they felt was, wow, if we continue to do these trainings, we want to make sure that we have those. And also, these are lessons learned. Maybe if someone else wants to provide a training like this to clinicians, these are the points that maybe they should think about including. And then the conclusion was that, of course, that the pilot training enhanced knowledge and skills of participants. And, next steps would, do more trainings, roll it out further. So you can see that they hit all the sections in the abstract. And it was submitted to the Munich AIDS conference that was 2 years ago. And you can see here, this is just a little bit of the poster, after it was accepted. And, I didn't put the whole thing, but, it was pictures of some of the clinicians who attended the training, right? Um, so this is actually a two-part webinar. So today we're talking about writing an abstract, and the next webinar will be your abstract's accepted. Now what? And we'll be talking about how to create a poster or an oral presentation. So we'll be going more into how to do that. A few things that are really important when you're writing your abstract is always use people first language. So this would be, for example, using language such as, people or person living with HIV, not using, HIV infected person, spelling out the names of key populations. So, gay men and other men who have sex with men instead of saying MSM or, sex workers and their clients, like avoiding acronyms. So we tend to do that a lot, especially an abstract, you're only allowed usually 350 to maybe 400 words. So, people will just say things like KPs, and that's really not appropriate. Um, you know, talk of the response to HIV and ending the HIV pandemic. Don't use war talk, right? War on HIV or the fight against HIV. Those aren't terms that we should be using. So I want to give you an example of maybe what not to do. Okay. And when we'll talk a little bit about why. So uh, this was not submitted by anyone. I made it up. I just want to say. So innovative HIV cascade optimization for key populations in rural Tennessee. Okay. So as you read that title, it doesn't really say what the team was doing. It was innovative. It's key populations. I don't even know who that means. Okay, it's rural Tennessee, but I don't know anything else. But okay, we got this far. I don't really like the title, but let's go and look at what they wrote. So the background, they put MSM slash TGW, assuming that's transgender women. But again, remember I said people first language. We shouldn't be using acronyms. So anyway, they were in Tennessee. And then it says demonstrate suboptimal cascade engagement due to multifactorial determinants affecting intervention uptake. which mandates an integrated biomedical behavioral strategy to address persistent gaps and accelerate epidemic control metrics in alignment with global UNAIDS thresholds. I've actually seen abstracts written like this. I think that you will agree with me that that background didn't make any sense at all. It was filled with a lot of jargon. And yes, it didn't really explain the background was not clear. Like, why is this work important? I'm not really sure because I didn't understand what was written. But okay, we got this far. Let's go on to methods. So the methods, we implemented a multi-sectorial tech-forward pilot leveraging an optimized service delivery framework with differentiated modalities. All MSM TGW attending our hub from 23 to 24 were exposed to the intervention. Data were extracted from the system and analyzed using an advanced dashboard with numerous indicators. Again, it doesn't make sense. It's a lot of language, a lot of jargon, um, not using people first language. I don't really understand because you didn't explain the intervention. And I don't even understand what you did with the data, but okay. Again, we got this far. Maybe it gets better. Okay, we have results. A total of 842 HIV-infected individuals were enrolled. Again, a lack of people first language. Overall service uptake was 62%, compared to what? I don't know. Retention increased by 7%. From what I don't know. Engagement indicators improved between 3 and 19%, depending on the metric. Viral load suppression increased from 48 to 55%, and client satisfaction was good, with 41% reporting the platform was helpful. Okay, and their conclusion, our intervention demonstrates that multi-level HIV cascade optimization can potentially enhance outcomes in high burden zones and should be scaled up. So this is, I think, a good example of what not to do. Um, I think that if you were reviewing this, and this is, actually, this is from IAS, where the reviews look at, does the study contribute meaningfully to the field as an original study or useful confirmatory study? You would probably not rate that this very highly because they didn't really explain the importance. We don't understand the impact. And when you look at the science, the question for reviewers would be, is the study or research design of high quality and sufficiently explained, including clearly stated questions, data sources, data collection procedures, and appropriate analytic approach with clear and consistent results? I think you would say probably not. I think the first thing is, do you even understand the abstract? And if you don't understand the abstract, you're not going to be able to score it. So I just wanted to put that as an example because, I do see a lot of abstracts with a lot of these words thrown together. It's kind of like a stew. And so that's what to avoid. And we're going to move on to a different type of abstract. So this is reworking it in a way that makes it understandable. So here's the title: Improving Access to HIV Prevention and Care for Transgender Women Through a Community-Led Service Model in Rural Tennessee. We know the population. We know the results, right? We understand what you're doing. You're trying to improve access. It's a community-led service model. So I already have an idea about what the intervention is. So this is very clear. So what is the background? It says very clearly, transgender women experience disproportionately high HIV prevalence, yet remain underserved by traditional clinic-based models. Community-led gender-affirming strategies may improve engagement and retention along the HIV prevention and care continuum. This makes total sense. Yes, there's a need. There could be a really important impact here. I'm really interested in hearing what you did. I'm very excited. Let's see what your methods were. So it says we implemented a community-based program offering peer navigation, HIV testing, PrEP linkage, and care coordination for trans women, provides the dates, and tells you what they did. The program data were prospectively collected and disaggregated. Outcomes included HIV testing uptake, PrEP initiation, retention at 3 and 6 months, and viral suppression among participants living with HIV. Again, using people first language, very clear metrics, explains exactly, how you collected these data. No hidden, nothing hidden, very clear and coherent. And the results, it shows, 412 trans women enrolled, tells you about uptake of HIV testing increased from 54% at baseline to 81% after implementation. So you can see the change clearly that wasn't seen in the last abstract. The PrEP initiation rose from 22 to 47%, tells you about retention at 3 and 6 months, tells you about people living with HIV. The viral suppression improved from 49% at baseline to 72% at 12 months. Talks about qualitative interviews that indicate the importance of peer navigation, reduce stigma, and gender-affirming staff practices. So the conclusion here is that a community-led gender-affirming model significantly improved HIV testing, PrEP uptake, and viral suppression. And the findings support the expansion of trans-led HIV services and demonstrate the importance of disaggregated data for understanding program impact. These were the same program, two different abstracts. One was unintelligible and the second was very clear, right? So in this situation, if you were asked the same two questions, does the study contribute meaningfully to the field as an original study or useful confirmatory study? I would say yes, absolutely. And if we look at the science, is the, research design or study of high quality and sufficiently explained, clearly stated questions, data sources, data collection procedures, and appropriate analytic techniques? Absolutely. And you can see they just did descriptive statistics. This wasn't complicated. So, I would say that, the takeaway points here would be that, and this is many papers that have been written on writing abstracts, and I have a few of them in the resources. But, first of all, preparation is key to success in abstract writing. That the 4 C's are, they need to be complete, concise, clear, and cohesive. You need to write plainly, avoid jargon. The other thing to remember is that reviewers may not understand your terminology. Maybe you're using words that are very specific to your institution or organization. And it's always helpful to have someone outside of your organization read the abstract to point out to you if you're using any language that maybe people externally wouldn't understand. You want to be aligned with the conference theme. So if you're presenting something on, HIV research, maybe it wouldn't be a good fit for a different type of conference, right? A surgical conference. I'll just throw that out. One of the things that's sometimes very helpful, especially if it's the first time you're submitting to a particular conference, is look through old abstract books or archives and look at previously accepted abstracts. So you can see like what was considered a good abstract that was accepted, and if it's like, okay, I see some common threads here, and I know I can do this. Please do a grammar and spell check. There's nothing worse when reviewing an abstract to see that there are mistakes. And also it's, what you submit is what is printed, right? So if you discover after the fact that you've made a mistake, unfortunately, it's going to live on forever in that conference archive. Remember to follow word counts and formatting exactly. There are many abstracts that are rejected just on these technical issues, and we'll talk about some of those in the next upcoming slides. The other thing is, how do you decide what conference to submit to? And there are a few things that you should look at. Every conference has its own focus, and you want to pick the one that obviously is the best fit. You want to look at the submission requirements. What is the timeline? If you just think about it like the abstract submission is closing in a week and you haven't started your abstract yet, it's probably not going to work. So, you do need to think about this really ahead of time. Who's the audience? Like, who's going to this conference? The cost is certainly really important. It's the saddest thing, I think, is sometimes when we submit abstracts, they get accepted, and then we find out afterwards that we actually can't afford to travel there, or we can't afford the registration. It's really hard to raise those funds. Um, I mean, I would just say consider some of those as you're applying. Some of the examples would be, we'll talk about them, AIDS 2026, if, the focus is on HIV. So, HIV, PrEP, PEP, community responses, policy, stigma, trans HIV outcomes, all of these would be a good fit. A WPATH, the World Professional Association of Transgender Health, also has a meeting next year. The focus is on trans health and clinical care, so gender affirming care, human rights advocacy, and community-led models. So, just think about what some of the like the focus of the conference. So I'm going to just turn on to a few slides. These actually came from the IAS. And they were developed in, just to show the abstract timeline. So abstract submissions opened in November, and they're going to close the 27th of January 26. Then the next month, they'll be doing abstract reviewing and selection. In early to mid-April, the notifications will be sent. There's another opening of abstracts. This will be for late breaker abstracts in April, May. And then in May to early June, the late breaker abstracts will be reviewed and selected. And then in mid-June, the late breaker abstract outcomes will be sent. IAS is very interesting in that there are two options for submitting an abstract. Option one is like the traditional research template, right? So it's background, methods, results, and conclusions. Not all, programs, you know, or abstracts that you're building on your programs will fit neatly into this. There is an option two, which is suitable for lessons learned through program or project implementation or management. And this is the one that when I've worked with CBOs, like we've used this one because it's like background, description, so describing your program or project, the lessons that you learned along the way, and the conclusions and next steps. So I'm sure you can already think about work that you're doing and how it can fit into option two. I mean, option one again is also possible, but I think for many of the implementation of programs that we do, probably option two. The other thing is that when you submit your abstract, you have to choose a track and track category. So, they're listed here, track A through track F. So, track A is basic and translational science, track B is clinical science, track C is epidemiology and prevention science, track D, social and behavioral sciences, track E is implementation science, economic systems and synergies, and track F, political science, laws, ethics, policies, and human rights. So you need to think about how your abstract can fit into, one of these tracks. And again, there are kind of subcategories after that. There's a word count. Remember, I said you need to pay attention to that. The word count limit is 350 words. You can have up to 2 graphics that don't count towards the word limit, which is new for 2026. And again, as I pointed out, people first language, and they do have links where, and I've included them in the resources of like what to write, what not to write. Okay. And then again, the reviewing process is going to be blind peer review process. So you don't know who the reviewers are who are reviewing your abstracts. They don't know either. There are at least 3 reviewers, and then there are scores. Each abstract is going to receive scores for two equally weighted criteria on a scale of 1 to 10, and then the total overall score is averaged. And the average of all scores received by reviewers becomes the abstract score. And then based on that, you know, it's going to be accepted as an oral presentation or, an oral poster, or, there's also an opportunity for an e-poster, or unfortunately, it won't be accepted. So we went through this. The reviewing criteria looks at impact and science. So we went through these on when we looked at the two previous abstracts. So the other conference I wanted to talk about was WPATH, which is going to be in Mexico City in 2026, obviously with a focus on transgender health. Who attends WPATH? A lot of people. There are clinicians, health professionals, community leaders, public health folks, NGOs, CBOs, stakeholders, policymakers. I mean, it's very broad. So you don't need to feel that because you're not maybe a clinician, you can't go. Absolutely, there's a place for you there. The abstract timeline, it opened in October. It's going to close in April of 26. Abstract reviewing and selection takes place in between April and June, and the abstract outcome notifications will be sent out on the 10th of June. It looks a little bit different because there are a lot more categories for this conference. You can see them all here. There actually is a section for HIV. So, but again, there are everything from sexual health, reproductive health, chronic conditions, aging. There are a lot here. The submissions are a little bit different in that you choose ahead of time whether you want to submit as an oral, a symposium, which is like an hour, or a poster. And, you can see here, it tells, how many characters for the title. You have to submit both a short and a long abstract. The long abstract is 3,000 characters, which is roughly around like 450 words. And they use the introduction, background, specific aims, results, and conclusions. So as you can see, slightly different, but still in 4 sections. The reviewing process is also blind. It's 4 reviewers for this, and it's scored between 1 and 5. And the total overall score is average. So it is a little similar that way. So, be aware of submission rules, submission deadlines, don't be like me and wait till an hour before the deadline to try and submit your abstract. I did that last year. It was a disaster because everyone was submitting, the website was crashing, there were so many technical issues. Do start ahead of time. Again, think about your word count. And the other thing is that the call for abstracts, when you're checking the boxes, they may ask you if you're submitting for an oral presentation, a poster, or other form of presentation like WPATH, or others will accept the abstract and only the highest scored ones will be an oral and then a poster. So some conferences won't accept abstracts that have already been presented elsewhere, and you do have to declare that. So just to summarize, keep it simple and focused. What do we want people to remember? What's important, build the abstract around that. Use respectful, community-centered, people-first language. Avoid the jargon. It's very tempting to do it, but please don't. Tell a story of impact. Why does this work matter? I mean, you know why it matters, right? If what you're trying to do is share your work with the world, right? How does it change things for the community? Why does this work matter? You're going to follow the conference structure. So, if it's background, methods, results, conclusions, follow that and stay within the word count and character limit. I put this because, sometimes as you review an abstract, you'll see that they put the results in the methods, or they'll put results in the conclusion. You have to be really careful. You're going to be scored depending on the background, the methods, results, conclusion. If your results are in methods and not in results, you're not going to get scored for results. Okay. And remember that your voice really matters. It's so important to have CBO perspectives and lived experiences. It's really essential to the research and program implementation. And again, you are the expert. So as far as just a few resources to take away, I've got two papers here, How to Write an Abstract for Presentation. That's was published in 23. I think we can probably get PDFs to you. Also, How to Write a Comprehensive and Informative Research Abstract. These are, I think, two of the best that I found, really went into the weeds of what to do. There's an article from International Journal of Transgender Health on language and trans health, best practices, and then, of course, the links to AIDS 2026 and WPATH 2026. I will say that also IAS did have an excellent webinar on abstract writing, and there's a QR code, and that's a recorded session that you can still access. So we're going to move on to the Q&A, and hopefully we have some questions. And I just also wanted to say, I'm going to turn off my slides, but a huge thank you and acknowledgement to a few folks, Leo, who's the executive director of WPATH, for sharing the abstract, everything information about abstracts from WPATH, and also IAS that shared the slides from on abstracts from there.